Hi, this is Steve Dubin. I am the host of Business Way Outside the Box and also CEO of a lightly used PR firm called PR Works. We specialize in businesses that are way outside the box. They either do business in unusually or just unusual businesses. And we do a lot of work within the cannabis space, from startups to companies that are at the mezzanine level. And today's guest is Len May, who is the CEO of EndoCanna and has a vaunted past. His LinkedIn CV was longer than anyone that I've printed out so far, 9 pages. He broke the record. So that means he's either done a lot in his short lifetime or he can't hold a job. Maybe he'll be able to tell us the difference between the two. And he's doing some very interesting things with DNA testing and using that to cross-reference the better choices for cannabis, given what your DNA shows. And Len, now's your time for rebuttal to all of that. In particular, tell us a little bit about. Let's start actually at the beginning, if you don't mind. What brought you into having interest in cannabis?
Yeah, thank you, Stephen. And thanks for that intro. The reason why I have that 9 pages, which I didn't know how long it was because I never printed out my own, is the reason why I got into cannabis. So when I was a kid, I would be the kind of kid that would sit in class and I have all these thoughts that pop into my head. I wasn't really able to pay attention that well. I still did fairly well in school, but I was diagnosed with ADD when I was a teen, and I was put on all kinds of prescription medication. So I was lucky enough that I met some older kids, and I was right before class started, they asked me if I wanted to smoke, and I assumed they smoking cigarettes. I'm like, yeah, cool kids. I'm just starting high school. Let's see if we can hang out with the older kids and smoke a cigarette. So found it pretty interesting that they only had one cigarette that they were passing around, and everybody was taking a drag, and I took a drag and inhaled because I was dabbling in cigarettes back then. And I'm like, and I coughed, and it didn't taste like a cigarette. And then maybe I took another one, and I went back to class, and all the windows that were in my head started slowing down, and I could hyper focus and I could pay attention. So I was like, this is interesting. So slowly I stopped taking the prescription medication, and cannabis became sort of my go-to therapeutic medicine.
Okay. And my understanding, and having done some research on you, is that it wasn't all that well accepted by your family.
That is correct. My family my family comes from the old Soviet Union, and they were very conservative. They didn't even understand what cannabis is. It's pot, it's a drug. And my parents ended up kicking me out, and not only kicking me out, but also calling the cops on me, trying to have me arrested, which was an interesting experience. And the irony of this whole thing is my parents both consume, products that we've developed. And I actually had an experience with consuming cannabis with my dad, who was in his mid-70s, when we were hanging out in Jamaica together. So he takes pride in what we do now. So it came full circle.
That's great. And I know that you've done some things in high tech, you've done some things in marketing, and now you have this very unusual business that has been profiled in some major publications like Forbes and Bloomberg. Tell me about your, what your work model is and what makes it different.
Well, the idea is that everyone has a personal experience with everything. And our DNA basically is the blueprint. So if we're able to look at our DNA and use our DNA as a predictive measure for outcomes, you can help to avoid an adverse event. So the reason why I even started this is because, first of all, I was on my own personal journey, and then I was an activist. I was the president of the Cannabis Action Network. I held rallies and all that stuff. But when I moved to California, to Los Angeles, I got into the dispensary space. And the reason why I got into the dispensary space, I thought that was the best way for me to be able to help more people with this plant. And I was in a dispensary with a coworker, and they wanted to consume some cannabis. I said, "No." What he was asking, "What do you have?" And I said, "We have this sativa dominant hybrid, or sativa." I didn't even know that much of the different sativa and indica at that time. And he was like, "Oh, no, I can't consume that because that puts me to sleep." I said, "No, it's sativa. It's like sativa's up, indica's in the couch. That's all I know, right?" He goes, "Not for me." So I was like, that's interesting. Not for you. And then what I started seeing, I started paying attention to people that would come in with the same symptomatic conditions, and they would consume the same cultivar or strain, as somebody will refer to, and have a different experience. And I really started focusing on the plant genetics. And I was lucky enough that I met a gentleman named Kevin McKernan, who was one of the first people to genetically sequence cannabis. Long story short, went to work with them and over at a company called Medicinal Genomics. And what I would do is I would travel the US and I would get plant material from different growers and bring it to my lab, extract the DNA, which they taught me how to do that, send it to a sequencer in Boston. And we started the first library of cultivars called Cannapedia. So the interesting thing about that was that I could see that something called Blue Dream may not be Blue Dream in 5 samples. 2 of them may be Blue Dream, but the other ones are not. And we were just labeling things with names that really didn't mean anything. The second part of that is pharmacogenomics. So the parent company of this of Medicinal Genomics was this company that did genetic testing for diseases. So cancer, epilepsy, autism, all kinds of different diseases. So I started understanding that we have human genetics and different biomarkers within genetics, and seeing how the plant genetics can kind of coincide with the human genetics. So in 2017, we launched Endocannabinoid Health. In the first 6-7 months, all we did was research. So we looked at every single SNP, which is a single nucleotide polymorphism, which is basically your genes unfolded. And we're looking at those specific markers that are directly or indirectly associated with your endocannabinoid system. Once we did that, we then approached a company called Illumina to create what's called a chip. So basically, it is really a chip, and it looks at different markers on your saliva to see if they're present in your saliva based on the assay or based on the chip. And then from there, you're looking at what's called a genotype. So we have, like computers speak to us in a binary code. We have this user interface, but it's all ones and zeros. DNA has a 4-letter code, a C, a T, an A, and a G. So the combination of those letters are our genotype. That's our genetic predisposition. A lot of genetics we're born with that we can't change. So like your hair color, your eye color, your skin color, all those things. But the rest of them are indicators that whatever you do in your life can actually turn those switches on or off. So the idea of having this information about what's involved in your consumption of phytocannabinoids from the plant and how to avoid those adverse experiences, that's the impetus for the companies. The way we do it is we create a kit. It's a buccal swab. You swab the inside of your mouth. It's fully HIPAA and GDPR compliant, so it's de-identified. You have to register, and you ship your sample over to our lab. In a few weeks, you'll get your results back. You log in, and it'll show you a profile of your genetics based on symptomatic conditions. So things like anxiety, mood, sleep, inflammation, all those different things will give you an indication of what is the profile that's more aligned to you. So it's personalized. The second thing that we do is we look at dosing based on metabolic function, how somebody metabolizes. And the third part of that is drug-to-drug interaction. So we look at different medications that people consume and see if there's an interaction between their, phytocannabinoid intake. And all that information goes to a matching algorithm that looks at different products that are more what we call endo-aligned or genetically aligned, that are more aligned to the individual. and where they can get those products. So it's a truly personalized therapeutic experience.
Great, and thank you for that explanation. What percentage of people buy this on an individual basis by going to your website or giving you a phone call versus getting referrals from the medical industry or the medical community? And if they do come from physicians or alternative therapy folks, who tends to believe in your service?
Yeah, so I would say that probably about 70% of our customers are consumers that buy online at endodna.com, and the rest are through physicians' offices. So we have clinics, for the most part, I would say functional medical professionals all over the world. And those people, it's believing in DNA. DNA has been used as diagnostic device recommendations for many, many years for BRCA gene, for breast cancer, et cetera. So everything that we provide has a peer-reviewed reference. In addition to having those references, we also have epigenetic response. We provide a biometric device that looks like this if your audience isn't watching, but it's basically a strap that I wear around my wrist. And that tends to look at what are the different biometric expression based on your consumption. So yes, doctors, and the last part I didn't mention before, if somebody's already taken a DNA test, and there's about 30 to 40 million people that have taken some sort of DNA test, you don't have to swab. You can just use the data from your 23andMe or your Ancestry, upload it to our site, and you get results instantaneously. So we're not going to tell you your fourth cousin twice removed that living in Arkansas or Iceland or something like that. What we'll tell you is I sort of equate what we do to a GPS system, Waze. So what we'll do is we'll show you, like Waze, that this road over here may have a traffic jam, it may have an accident on it. Take this road. It's a better road to take. However, we don't guarantee there won't be a pothole along the way. But the interesting thing about Waze, what it does is if there is a pothole or there's a broken down vehicle, it asks, is it still there? Thumb up. And we do the same thing. So the more feedback that we get from users, that is exactly where we're getting the epigenetic responses. So just because you have a blueprint that says, hey, this may be, you're predisposed to this, is it really expressing itself? And that feedback goes into our deep learning AI. And the more users we have, the better the suggestions will become.
Okay. And you reference it's a community that provides feedback. How large is your community at this point, approximately?
We have several thousand members that have used our services. We've also been involved in clinical studies, clinical research. So not only published PubMed research that we've done recently on something called cannabinoid hyperemesis syndrome with Dr. Ethan Russo and the Credo team, and that's published, you can see on PubMed. We're also conducting a longitudinal study with Harvard Medical. And so every single patient that goes to McLean Hospital at Harvard Medical gets swabbed with our EndoDNA device. And we're looking at anxiety. We're doing a sleep study right now that's going to be clinically published. We have a study at CU Boulder that is an NIH granted study. And we're looking at biomarkers from the blood based on pain and the correlation between anxiety and pain and seeing what the efficacy of different formulations are. And then we're doing a pretty extensive study north of the border in Vancouver, not only looking at phytocannabinoids, but also looking at psychotropics as well on mental health. And we just filed a patent on a mental health test that should be reimbursable as well.
There's a lot of interesting things going on. And part of the research I came up with was you had a connection to the pandemic and the immune system and your DNA research and cannabis. Yes?
Well, yeah, but we have to be really careful about saying, because what we wanted to do in the beginning of the pandemic, we wanted to show people if they have a predisposition to related coronaviruses. So influenza is one of those. So we have enough research which is public research that you can search for, that there are genetic predispositions associated with not only being more prone to influenza, but also the severity of influenza. So what we wanted to do is we gave this away for free. So we showed people, if they already have a 23andMe or Ancestry, just upload, go through that and see if you have this predisposition. There is a correlation between the two, but social media was not really fond of us mentioning COVID or a coronavirus, but it's still available, and we definitely have a belief that, and we've seen anecdotally, based on patient-reported outcome, that there is a correlation between the severity of influenza and what people are seeing with COVID.
Okay. And I think that all too often people make erroneous assumptions about everything, but in particular pricing, right? So this sounds like a real breakthrough kind of service. And I'm guessing people will assume that they need to take a second mortgage for this as opposed to what it really costs. Maybe you can give us a ballpark figure.
Yeah, I mean, we wouldn't mind if somebody had taken out a second mortgage and funded our company in our Series B round, because that's what we're doing right now. However, it retails at $199 US, and your raw data upload, and that is if you've already taken your 23andMe or Ancestry or any of the other ones, that's $49.95.
Okay. And let's say I took that test and you ran your results and you determined that there's a certain cannabis that would probably be better for me because I'm paranoid in general. How good are the dispensaries in having consistency, as well as the cultivators and having consistency in product, so that I have a better chance of matching up?
Yeah, that's probably one of the biggest challenges in our industry. I just came back from Canada too, and it's even more ridiculous there because you can't advertise. There's very little terpene testing, and I think people don't understand that terpenes are really some of the secret sauce to an experience. So they work with the cannabinoids or the phytocannabinoids for that. So yeah, what we do is we look at the test results from different products called certificates of analysis, or CFAs. We run that through an algorithm and we show you what the percentage of match is. We also have IP pending on 8 different formulations. We license the recipe for those formulations to manufacturers around the world, so they can use their production methods and get more honed in on specific formulations. So until it becomes standard that people test for cannabinoids and terpenes, I think we're going to have some gaps. And it's state specific. So it depends. California, we're pretty spoiled. There's a lot more products in California than there are in New Jersey or Pennsylvania that are on point. So until we get all the manufacturers to be able to be on the same page and test for everything, I think it's a little bit of a long way to go. However, one of the things that we're doing is we're communicating back to the community of cultivators, manufacturers, on what products are more efficacious, or what ratios of cannabinoids and terpenes are more efficacious for different people. So what that would do, it would save them time in cultivation and manufacture. So it takes the guesswork out, and they can be a lot more precise on their formulations and growing their cultivators.
Okay, great. And it seems you have a very novel idea. Is there anybody out there that competes with you on somewhat equal level?
On an equal level, I would say no, but there are competitors. I mean, we started this industry, and it's good to be first to market. But when you're first to market, you definitely have people that are going to ride your wake or draft, or however you want to say it. So we know there are competitors out there. There's a handful of companies maybe trying to do something similar. To be honest with you, I always feel our competition is ourselves. We have IP. We're the only one in the field that has IP. We also have technology. At the end of the day, we don't consider ourselves a cannabis company. We're more of a health technology, a biotech company. We created software that is able to translate DNA and provide reports for anything. Cannabis is just a start. We have a lot of other things. We can do specific nutrient deficiencies. We can do vitamins. We can do skin. We can do mental health with psychotropics. Many, many, many different things. So yeah, there are companies that are out there, trying to do the same thing. There are companies that are doing the same thing for vitamins. There's some companies that are doing the same thing for foods. But we tend to be the company that translates all that raw information and is able to provide this reporting mechanism in a HIPAA compliant portal. So, and the idea is it's always learning, so it's always updating. So every single time there's research that's peer reviewed that comes out, and we're involved in research, your reports are always going to be updated. So that's kind of how we feel we differentiate ourselves from everybody else.
Great. And so as the innovator, as the pioneer and the trailblazer, what has been the biggest bump in the road? I'm sure you've had a number, but maybe you could pinpoint one.
Yeah. I mean, there are definitely many. We never thought that we would be pigeonholed as a cannabis business. And that has been an obstacle that has been extremely difficult to overcome. I would say that if we had a dispensary, it would be much easier for us to advertise our dispensary than it is our biotech company, because our merchant services are high-risk merchant services. Banking was really difficult to obtain. We don't even touch the plan or come near it in any way. Instagram, Facebook, advertising on Google. It's been challenging because when you look at our website, we talk about the endocannabinoid system. And these algorithms that are created by all these companies, they don't realize that just because the word says endocannabinoid, it has nothing to do with the plant. It has to do with a system that's a primary regulatory system that not only all the humans have that are looking at this thing, but also all mammals have as well. So it's been really, really frustrating to be able to educate all these different companies out there. And we're trying to see why can't we advertise just like anybody else who's advertising for personalized vitamins, et cetera. So that's been a big challenge to overcome.
Okay. And one of my last questions is really, so I've done my research, or at least I've tried. I feel I've got a good sense of who you are and what you're doing. What would I not find? What would our reader, our listeners and so on not find if they did a Google search on you? What is a unknown factor?
Interesting. That I paint, maybe.
Okay. All right.
I've painted, and sold paintings. Oil is my medium, and that's. And I'm a big music person, so music and the art sort of go together for me. I think that one of the biggest challenges through the pandemic was sitting at home, not being able to see live music. But what I was able to do was I'm a record collector as well, albums, vinyl. So I would come in I have this room in my house that has it's my music room. So I pull out a vinyl, I put it on, and I would paint or draw whatever the emotion that is evoked by what I'm listening to. So that's something that maybe Googled. I have no idea.
that I did not come across. Thank you for sharing that. Sure. Okay, I think we've sort of come to the end of our interview, and I know a lot of folks are going to want to get in touch with your company. What are the best ways of doing that?
Yeah, so my name, Len May, LenMay. It's Len May DNA on Instagram and Len May in all social, as well as LinkedIn. Our website is EndoDNA.com. You can find all the links there as well.
Okay. Well, thank you very much for spending some time with us, Len. I close the show by saying, I'm Steve Dubin. This is Business Way Outside the Box. If you know someone who has a business that's unusual, please contact us, and we'd love to consider having them on as well. look forward to seeing you at further episodes. Thanks again. And thank you very much, Len.
Thank you. I appreciate it.
Okay.